everyone, this is Dr. Dinh from the Gut Hormone Clinic. Just checking in with you guys, trying to give you guys some tips and tricks to try to help optimize for physical health. And today I wanted to bring up the topic of diabetes and prediabetes. So I've been seeing a lot of patients recently who, when we check their insulin or their hemoglobin A1C levels, when we check their insulin or their hemoglobin A1C levels, we see that they're still having elevations in those areas despite eating low carbohydrates, despite, trying to eat a lot of fiber, more protein, but still somehow this hemoglobin A1C still remains high. So after doing a deep dive with those patients, we find out that what's actually causing their A1C to stay high and their risk of diabetes still staying high is that they're eating foods or drinking things that could be spiking insulin that they're not aware of. So I just saw a client today who had been drinking things like athletic greens drinks or like green juice powders. He's also sipping on some like amino acid drinks, branched chain amino acid drinks, and also doing some like artificial sweetener, like stevia-based drinks, that sort of thing throughout the day. And it's not a surprise, he also has like sugar cravings throughout the day too, which is why he's drinking those things. And, had been doing those things because it's good for health, or he's been told that it's good for him. And so the issue with artificial sweeteners is that, yes, it might be calorie-free, it doesn't have carbohydrates, it won't raise your blood sugar immediately. However, it will cause an insulin spike. There's been numerous studies showing that artificial sweeteners or even natural sweeteners that are low in calorie, like stevia, can cause an insulin increase. And therefore, when you have high insulin, it causes you to have lowered insulin sensitivity, making you more prone to being pre-diabetic or diabetic. Also can contribute to weight gain and difficulty tapping into those fat burning cells and difficulty losing fat. And so after doing a shift and stopping those artificial sweeteners, or what I call fake sweet foods, that can really help with your risk of, preventing risk of diabetes progression and also help with fat loss. So those of you out there who this applies to, hopefully this helps. And it's all about lowering insulin and improving that insulin sensitivity. So hopefully that's valuable to someone out there. Until next time, bye now.